joining us. Today's panel, today's conference has been so amazing. It's been full of great speakers. I am so honored to be a part of it and actually have the chance to moderate one of these panels with three fantastic speakers. We will be touching on creating community partnerships to enhance diversity in clinical trials. As you guys know, in clinical research, trust and genuine community partnerships are essential to what we do. We work with communities that face historical and current barriers when participating in trials that are rooted in a lot of mistrust and inequities. And so today we're hoping to focus on how can we breach these gaps? How can we create partnerships that can foster inclusivity and bring trust and equity? So I just want to first go ahead and introduce our speakers. Let me start with Ms. Cornelya Dorbin. She is the Associate Director of Innovation Capability for Clinical Trial Diversity and Inclusion at Novartis. Thank you for being here, Ms. Dorbin.
Thank you, Diane. I'm so happy to be here. And one disclaimer I have to state before we get started is the views and opinions expressed are my own and not that of my employer, but glad to be here and share as much insight as I can with our panelists.
Awesome. Well, thank you. We're happy to have you here. And our next speaker is Dr. Trinh. He is the Chief Medical Officer at Healthy Brain Clinic, and it's based in California. How are you, Dr. Trinh?
Good. Thank you for the invite to be here.
Yes, we're happy to have you here. How is sunny California? It was cold this last couple of days. I was there.
Sunny. Right now it's all blue skies, so it's good.
Okay. Good. And lastly, Dr. Mickeal. She is a consultant of recruitment and strategic initiatives at a postdoctoral research fellow at the University of Kansas, ADRC. How are you, Dr. Key?
I'm doing well. I'm so glad to be here with you all.
Thank you. Thank you, guys. Well, I'm going to kind of do this more, just ask some questions, and I'm going to direct some of them to some of our speakers and our panelists. Whenever you feel you want to add something, just go ahead and do so. My first question is directed to Dr. Trinh. Why do you believe community partnerships are essential in enhancing diversity in clinical trials?
I believe partnering with the community essentially is where you build the bridge of trust. And just to give you an example, our mothership where we do the majority of our clinical trials is in Irvine, California, which is not that diverse as far as the diversity we're looking for, but essentially what we've done is last year we opened up a site here in Long Beach, Los Angeles County, where I'm at, and our site here is probably at least 50% between Black and Hispanics, and so you have to be in the community to find the partners, and you have to be located in the community is what we've done to go toward that direction with diversity.
That is very true. Being able to not having sites that are close by to the communities they're serving, so they don't have to drive an hour, 2 hours to get to a site is so important. So, okay, well, thank you. Any of our speakers want to add anything to this?
Sure. I would have to say, partnerships are required when it comes to recruiting and enhancing clinical trials and representation. You're talking about increasing access and building trust, but a lot of times we see that as one directional. A project comes online and you're like, oh, we need our partners, we need some community members to come on board. And those should not be one-offs. They should be a long-term investment, a strategy. And another consideration is that they need to also be, I think, intergenerational. When you talk about Alzheimer's disease, it's not just about older people. What I've seen in the last couple of years, where we've seen caregivers that are college students that are taking care of their parents. So you want a large representation of stakeholders to come in and help influence your strategy when it comes to recruitment, but also feel like they are not walking in without having any ownership. We have a variety of patient advocacy groups and partnership groups. But one thing we did, we started having them sign a memorandum of agreement. And that way we could spell out, like, here's our role, here's your role, but there's some reciprocity. It's a reciprocal response, so that it's just not one-sided or one-dimensional. It's give and take. And so I think you really want to leverage your partnerships and your assets and ensure that it's long-term.
Thank you. Thanks. Thank you.
I love that. I would just add just quickly, like, also, I feel like when we think about these community partnerships, you know, as it's been mentioned throughout the conference, and even you mentioned it, Deanna, these communities have built up a protection because of the historical and current abuse that they've experienced, you know? So couching it in a relationship, it needs to be a healthy relationship, right? A healthy relationship is give and take. And I also think it's good to think of it as redistributing power as well. When you have a institution with the money, you know, the resources, you know, I like to think of it as redistributing power as well. When you're able to like figure out how can you help the community that you're trying to interact with before you even have an ask, right? So, but I agree with the other panelists on everything they've said as well. So.
Yes, thank you. Thank you for that. And to build on that, my next question is, trust is, as you know, isn't built overnight. So what strategies have you guys found are most effective for fostering long-term sustainable partnerships with community organizations and partners? Dr. Trinh, if you want to start us off.
Absolutely. Add value first. Before you ask, add value first. And an example is I would go in the community where we're at here in Long Beach, give monthly health education lectures at no cost. We also provide lunch along with that at no cost to the attendees. And the lectures are always different. They're different topics. They're not always Alzheimer's related. But what are the concerns of the community? Are they concerned not only with Alzheimer's, are they concerned with diabetes, obesity, hypertension, cancer? And we would tailor our lectures on a monthly basis based on their concerns. What is their why? Why are they there? Research is always a last pitch. I always add value first by figuring out what their concerns are with their health. What are the issues? What are their barriers? How can I educate, you know, my attendees with that? And if they are interested, come on in for a no-cost consultation where we can talk about research with that. And we do that on a monthly basis at various locations where the community, the diverse community lives with that. So that's kind of my belief in adding value first.
Thank you. Thanks. Thank you.
And I would echo that. I mean, you said add value first. You also mentioned continuity. It's monthly, like it's not a one-off, it's not ad hoc. And I have a saying, I like to go where we're invited, and I like to go where we can return. So if you are inviting me, you better know we have to come back and not come back just with lip service. I mean, we're going to come with resources. We want to know, how can we leverage the assets within your community, your corridor? Some of it is matchmaking. They may not even be aware of some of those resources. And it's sometimes just in heightening their awareness and tailoring some of their resources and building them out, but not, leaving them and hanging them dry, I think is what I want to say. And so communities, as it's been mentioned, they're already overwhelmed. And so you're bringing in this cultural competency layer around building trial education, increasing access, talking about something so foreign that they may think you're trying to guinea pig me. You want to give me a drug. No, no, no. I just want you to take a survey. And if that's the engagement, do share the results with them. If you are collecting data, don't just collect data and never offer any feedback. Anytime we survey individuals, we are offering that feedback within a timely manner. And then we're implementing the feedback. And so that builds trust.
Definitely. And adding value. I think you come from my mom's schooling, where she always used to tell me, it's not getting invited, it's asking you to come back. So I agree. And you can apply it in this as well, of course.
Mm-hmm.
Dr. Key, do you want to add anything to?
I mean, my colleagues described it so well. I would just be repeating the same things that they said. I mean, it's really about an intentional commitment. And it's not all about what you can get out of it. I think it's been mentioned earlier, the Black Healthcare Coalition has been a beautiful trusted partner of GAP. As well as KU, ADRC. And they just had I think it was a 30th year. I think it was a 30th year celebration. But they had this great, event, and we showed up. We were there, It's like, yes, we want to celebrate you and all the things that you've done in the community, and show you that we're behind you, and that we appreciate you. And so it's even things like that had nothing to do with anything that we were trying to do or get across, but it's like, we're here and we're not going anywhere. So yeah, that's the intentionality is really the big part of it.
Well, thank you. Well, my next question is, what role does community feedback play in shaping your engagement strategies with these community partnerships? And if you're able to, can you share an example of how community input led to a change in your approach? Whoever wants to go ahead and start.
I have an example. So we have an advisory group, and we offered this an opportunity up to some of our investigators to share their protocol, and whether they were midstream or just getting started, and the aha moments that the investigators had, and also for the stakeholders, they're like, well, why would you approach why would that be the approach? What in your mind made sense? And so they went back and revamped their protocol. So I think there are opportunities that we assume we don't need to have that input and that influence until downstream, when the earlier the better. That way you can, there are some missteps you don't have to have. The other example is we did focus groups with men and Black men and asked, what do you want? Like, we have an idea, but we are seeking funding to support some longitudinal research for you. And so what is it that you all want to hear about? And as the doctor mentioned earlier, yeah, it's pro-health. We always want to go from the lens of talking about pro-health messaging. Everyone isn't sick. Everyone doesn't have comorbidities. But if they do, here's how you can keep what you have for as long as you have. And so a lot of our messaging isn't around sick care. It's about improving the health you have. And so that may go without saying, but they let us know, hey, these are the topics I want to talk about: impotence. and I want to hear it from someone who looks like me. And so for 3 years, we put on a monthly program where, yeah, ultimately I need you in research. You know, that's where you get sort of that white glove treatment. However, in the meantime, are you managing your cardiovascular health? Did you know you can get some medication management through your pharmacist? You know, giving them opportunities to be allies for their own health. And so I really think, you know, using that input, but also adding not just value, but tangible milestones that they can actually implement independent of your research center.
Fantastic. Well, thank you. Thank you. Anyone wants to add anything?
Community feedback for me is live in real time. In the lectures we do, it's I don't do like one-way lectures with PowerPoint. It's more of a discussion, and so part of the feedback at the end of each, you know, discussion talk with the community is like, what do you want to learn next? Right? What's on your mind? What topic would you like next month? And it's usually a conversation. When I think of feedback, I think of a two-way conversation as opposed to a one-way message delivery with that. And that's kind of the way we get feedback. In the office, what's next do you like in our snack box, right? What's your favorite? And we would tailor often, you know, our snacks or our food or things of that sort when they're in the office for the studies. Yeah.
Thank you. Dr. Key, do you want to add anything?
No, I think it's been said before, right? You need to include the people who you're trying to reach. So, GAP's Inclusive Research Initiative has a advisory council that we've had for a few years now, and they've been amazing. I distinctly remember a meeting where, we had presented some materials, to the committee, and, it has, patients, and it has PCPs, and it has, caregivers and community members and things like that. So, we have, kind of a broad spectrum of individuals on it, and man, it did it did not go well. They were like, what is this? I think, Dr. Corbin mentioned, something kind of similar. It's like, what is that? And just think of how much money we would have wasted and people we would have alienated if we hadn't gotten that feedback.
So true.
That's not what is going to attract us. That's not what we're looking for. That's not even kind of like the the mindset that we're even in. So it's so valuable, and it just speaks to just making sure you look around and figure out who's at the table and who's not, and then making sure that you provide room for them. You pull up a chair, for them. So
yeah, absolutely. Absolutely. So we have 10 minutes. We're supposed to leave 10 minutes. There's no questions in the chat box, but if there's anybody that has some questions and would like to either put them in the chat or raise your hand, we'll be happy to answer those. Let me see if there's any on the Huba. Can't see anything here. Let me see. There's one here. How do you know when you've been successful at achieving a beneficial community relationship? Are there certain things you look for? Who would like to take that one?
I have 3 questions that is always in my mind when I go out to the community. And these 3 questions are directed toward, an attendee. And so in my mind, I want to answer at least the thoughts. If I was an attendee and the speaker's there in front of me, there's 3 things I think about. Number 1 is, do you care for me? Because quite honestly, there's a saying that, people don't care what you know until they know that you care, right? So do you care for me? The second question I would have as an attendee would be, can I trust you? Right? Are you authentic? Right? Are you trustable? Or are you just here to sell me research? Right? That's question number 2. Question number 3 in my mind would be, can you help me? Right? Is the material you're presenting helpful? Can you help me through your research? Right? The top of mind is, I'm concerned about my memory. I don't know if it's dangerous or not dangerous. Can you help me answer that question? And so those are the kind of the 3 questions I think about when I'm out in the community. Am I somebody that care? Am I somebody that is trustworthy? And am I somebody who can help the person listening to my lecture, right? Through research as a tool to seek to answer their questions with that. And that's kind of what I look at as a benchmark if I'm successful or not.
Thank you, Dr. Trinh. Thank you. We have another question here. It says, how do you break the barrier at a senior center that is resistant to clinical trial awareness? Anybody, Dr. Key or Cornelya, if you would.
Yeah, I think it, again, it goes back to, if you're leading with clinical research, right? Maybe that's, I don't know, possibly part of the problem, right? I think you have to figure out what their needs are, what are their concerns, and, sometimes, again, clinical research could be the furthest thing from their mind because there are other, like, more, higher order needs, right, that need to be met, before that can even kind of be considered. So outside of that, right, I think it's important to just see, like, okay, well, I mean, you're not going to go straight for a super complex protocol where they have to give blood and do scans and do this and do that, right? I mean, maybe it's even just starting with, again, I think it was mentioned before, like a survey, right? Or maybe just to, like, can we do an interview? Let's just see what your experiences are, either being a patient or being a caregiver or whatnot, because that can also be valuable. So I think it also depends on the type of research they're being asked to do, why they might be resistant to it. But again, if you're leading with research, maybe that is something that can be kind of put on the back burner until you figure out, what the actual needs are, whether that's education or whether those are services, support groups, something like that they might need. But more so.
Right. And it goes back to what you guys were just saying. It's adding value and understanding what is it that that community partner wants or needs. Like Dr. Trinh was saying, it may not necessarily be Alzheimer's and dementia. It could be diabetes. It could be something else. So absolutely. Yeah.
Yeah. And I would say, like, I've never used a senior center for recruitment because they have a menu of things that they do. It is a social place. And so I would use that just for rapport building and trust. My priority would not be to recruit there, because they have bridge, they have line dancing, swim. They're doing so many other things. So when we go to senior centers, it's really there to build allyship, an outlet where they know we're accessible to have a presence. And so it's never really about that direct recruitment. But if you want to talk about recruitment, I have an outlet or an opportunity for that. We've offered memory screenings on site at senior centers. So it's back to, as Dr. Key said, you might want to audit your efforts, because if it's ultimately to recruit from that environment, you may have to go there 10 times before you see some conversion. But for my experience, it's really been about building trust and rapport, and making sure that if they have an annual caregiving meeting or research roundtable, whatever they're doing, that we are always invited and we show up and show out, literally.
I use senior centers for recruitment, but I don't recruit for studies during my talk. So I go to the senior centers, and the talk really can't be led by the title research clinical trials, because that'll be a one-time talk, and you can't go on month 2 to say the same thing, or month 3 to pitch research every month, right? It just doesn't make sense. So at the senior centers, I rotate the health lecture topics. So 1 month is longevity, the next month is brain health, third month could be cancer, whatever it is, right? That the group wants to learn. But at these senior centers, there's always an invitation to come in for a consultation at our clinical site at no cost. We provide transportation if they need transportation. And when they come in for the consultation is where we do, of course, the memory assessments, and that's where we talk about research. I don't talk about research at the senior centers. But because the trust has been built month over month with different topics, folks were like, sure, I want a no-cost consultation with Dr. Trinh, right? And when they come to the office, it's when they learn about research. I don't lead with research at the senior centers at all.
Yeah. Well, on that, I do have an experience recently, and I know I'm the moderator, not the speaker, but I do have an experience recently where I work with a border town down here in Texas, and I wanted to connect with a community partner for just quite some time. And so I noticed that they had a conference, and I said, instead of me trying to ask, hey, how can I partner with you? I can do this, I can do that, I can do a chat, I can do a brain. I said, do you need anything? Do you need coffee? Do you need pastries for your attendees at your conference? And she's like, absolutely, we need pan dulce. And so here we go. I ordered, I don't even know. I think it was like 40 pan dulces and delivered them. And then I was able to establish at least a relationship with that community partner. She's like, oh, so tell me, what is it that you guys do? And so that started the conversation. So just being there intentional for what do they need, and giving them, like you guys have said, value. So thank you guys so much. We only have 2 more minutes left. So I don't know if you guys want to, any other remarks that you guys wish to share with our group. I really appreciate, thank you guys for allowing me to moderate such a great discussion. Love being a part of this. And our next session is our keynote speaker, Dr. Goldie Smith-Bird. So hopefully everybody can go in and join. And if you have any other questions, we have the Whova app. If you have questions for our speakers and our panelists, just go ahead and send them via Whova, or you can always reach them via email. I can share the emails later on. But thank you guys so much for everything.
Thank you. Great session.
Thank you.
Yes,
Bye.
thank you so
Bye-bye.
much.